A breast lift or mastopexy aims to target descent and deflation of the breasts over time. As we age, with the effects of gravity as well as physiological effects on the breast, such as pregnancy and breastfeeding, the breast starts to sag. In some cases, this is accompanied by loss of volume of the breast as well. The result is that the breast appears deflated and that the nipple areolar complex points downwards towards the floor, and we call this ptosis. When we do a breast lift, what we are aiming to treat is the sagging or descent of the breast, and also to bring the nipple back up to its previous position. In some patients, even when the breast tissue is rearranged, the volume isn't sufficient to achieve their goals. In these cases, we need to add volume to the breast, and this is commonly done by also inserting an implant at the time of surgery or by performing fat grafting to the breast. I suggest that you watch the videos on breast augmentation or fat grafting for further information. Breast lift surgery is performed in the hospital under a general anaesthetic and generally requires a one-night stay in the hospital. The purpose of this is to monitor for any unexpected early post-operative complications such as bleeding. Like any surgery, there can be issues with wound healing and infection, and with the breast itself, the other things that we're particularly vigilant about is the blood supply to the nipple complex, which has been moved. Some patients can have issues with the blood supply to the nipple complex and changes in sensitivity of the nipple. Breast reduction surgery does leave a scar. Most commonly, the scar runs between the areola and the adjacent normal skin. It then runs vertically downwards between the areola and the fold of the breast, and in some cases we also need to carry the scar in the fold of the breast as well. The decision on what scar pattern is required does depend on your anatomy and how much skin rearrangement and glandular rearrangement needs to be done at the time of surgery. Breast lift is an individualised procedure. We need to make decisions not only about the scar pattern but also about the target volume of the breast and whether we need to use any adjuncts to address that. The best way to make a decision about whether a breast lift is the right operation for you is to have a formal consultation and target physical examination. After this, we can discuss whether surgery is appropriate and create a plan that's tailored to your goals.